यहाँको अहिले मान्छेहरू चाहिँ नि एकदम तनाव छन् हैन उनीहरूलाई चाहिँ नि एकदम राहतको खाँचो छ त्योभन्दा पहिला चाहिँ उनीहरूलाई बस्नको लागि चाहिँ नि पालको चाहिँ नि जरुरत छ
बाख्रा चाहिँ अनि कुकुर एउटा गयो चारवटा गयो यसमा चाहिँ क्षति चाहिँ त्यही पशुमा चाहिँ क्षति भयो मानव क्षति चाहिँ भएन तर तपाईँको चाहिँ कस्तो भने भूकम्प आइसकेपछि आउँदाखेरि पछि चाहिँ त्यो सबै तहस नहसै भइसकेर निस्क्यो अहिले चाहिँ प्लास्टिकमा बसेको यो बच्चाहरूलाई चाहिँ अलिकति एकदमै नहोला जस्तो भएर अनि अहिले यहाँ यो छारो सेभ हो
घर भत्किएर के बहिनी घर भत्किएर सबै रित्तै भएर त्यो निकाल्न नसकेर कपडा सपडा बाह्र कुरा सबै त्यहीँ छ
My name is Dr. Tim Ring, and I am a clinical psychologist, and I specialize in the treatment of trauma. And I'm here in Nepal to help with the earthquake victims who have experienced psychological trauma as a result of the earthquake. Post-traumatic stress disorder is a psychological disorder which is characterized by a person's reaction to a traumatic event. Now, that particular event could either be external, or something that occurs outside of them, or internal, meaning that they might experience that event indirectly, or that someone else is talking about a particularly traumatic event and it's affecting that individual in distressful ways. When an individual experiences a trauma, they go into psychological dysregulation. It's very difficult to think straight, it's very difficult to take control of their feelings, it's difficult to make decisions, and it's all in response to the traumatic event. When a person experiences a traumatic event, they experience certain types of feelings which are distressing, and those feelings lead to particular thoughts, and those thoughts are intrusive. Usually they're distressful thoughts. They're thoughts that cause persistent worry, anxiety, hypervigilance, and then these feelings lead to physical symptoms. If I could give you an example of what it is like to have PTSD, if you could imagine driving your car or crossing the street and having a truck come by and nearly hitting you in your car or walking across the street, and it becomes an experience where it takes your breath away and you have to catch your breath and you get that feeling of butterflies in your stomach. Could you imagine experiencing that every day? That's what it's like to have post-traumatic stress disorder. Physical symptoms include but aren't limited to insomnia, lack of appetite, muscle tension, tension in your chest, gastrointestinal problems, headaches, persistent isolation, a lot of different types of behavioral symptoms that might be very, very different from their regular life. And then, as a result of experiencing those symptoms, people engage in what we refer to as an avoidance process. They do whatever they try to do to not experience the uncomfortable nature of those physical symptoms. And that would be alcohol abuse, drug abuse, hypersexuality, isolation, overeating. These are all unhealthy activities which cause a person temporary distraction from these traumatic events. And they work, but they work temporarily. The long-term effects of using those strategies cause more dysregulation in the long run. The triggers, again, could be external, or those situations that occur outside of us, like in the case of an earthquake, a truck going by outside that shakes the earth, thunder, a helicopter going by overhead that might create certain circumstances that parallel what was experienced during the earthquake. Those would be external triggers. Internal triggers might be walking by a group of people who are having a conversation, and that triggers the individual to again start to have these types of thoughts. Sometimes they might just have these thoughts randomly. Sometimes people are not even aware of when triggers occur. The triggers might even be a particular smell or a particular sound that they're not even aware of, and all of a sudden they find themselves having these feelings, these intrusive thoughts, and now they start to feel agitated and they're having all those physical symptoms. Those are examples of triggers. It's important to know that post-traumatic stress disorder, left untreated, can also lead to a variety of other types of psychological illnesses and disorders. Phobias, for example, can be a direct result of PTSD. In other words, people start to avoid certain places, certain things, and they begin to associate the fear with those places and things which are not even connected to the original traumatic event. Another common feature of post-traumatic stress disorder is what we refer to as comorbid psychological disorders. These are individuals who have been traumatized, who already had diagnosed conditions previously. People who have anxiety disorders, people who have major depression, they come into a traumatic situation with a heightened degree of severity, usually. And they're a little bit more difficult to treat. They've usually been treated before the anxiety disorder or the depressive disorder with medication, and it's very important that if they have been, that they maintain that medical protocol, or if they got off that medical protocol after the traumatic event, they should consult their physician to get back on that medical protocol. But with regard to psychological treatment of people with premorbid conditions, we can treat them, and we could get their symptoms to lessen down to their prior state of functioning, their prior levels of anxiety, but it's likely that we can't get those anxious levels to completely go away, because those are the levels of anxiety that they already brought into the circumstance. The other more complicated, difficult cases are situations where someone has experienced great loss. A parent that has experienced the death of a child or the death of a loved one. Very quickly after the traumatic event, they're not likely to be recovering. They are still going to be experiencing distress, extreme sadness and loss, and that's not going to go away for a long time. The appropriate thing to say to a person like that is not, "You're going to be okay, things are going to be fine, just give it some time." Because early on, that person is in so much pain, it's an insult to the pain that they're experiencing and the losses that they have also experienced. The appropriate thing to say is, "I know you are in pain, and unfortunately you're going to continue to be in pain, but it is so incredible that you get up every morning and you do what you have to do to get to the next day. It's such a great honor that you give to the loved ones that you've lost, and you need to continue with that every day. And someday, and I don't know when that is, in the future, it might be the distant future, the tears that you experience for the loss of that loved one may someday be mixed with a smile."